Missing paperwork is the number one reason a DOT physical doesn't get resolved the same day. And when that happens, the medical examiner has to place your exam in what's called determination pending status, meaning you've got up to 45 days to get the right documents back to the clinic before a decision can be made. That's 45 days where your certification is in limbo. So let's talk about what to bring so that doesn't happen to you. Every driver, every time. Start with the basics. Bring a photo ID. That's your CDL, driver's license, or passport. The medical examination report has a section specifically for identity verification, and the examiner needs to check that box before anything else happens. Bring your current DOT medical card if you have one. If your exam ends up pending, that unexpired card may be the only valid proof of medical qualification you have until a new decision comes through. Don't leave it in the truck. Bring a written medication list. Every prescription, every over-the-counter medicine, every vitamin and supplement. The examiner is required to compare that list against your health history. A vague or incomplete list slows things down. If you wear glasses, contacts, or a hearing aid, bring them. The examiner may certify you with a corrective lens or hearing aid requirement noted on your certificate, but only if they can actually test you with those devices in use. Now, if you have a specific condition, there are forms that apply to you directly. If you use insulin to manage diabetes, FMCSA requires a completed form called the MCSA 5870. That's filled out by your treating clinician. You also need to bring at least 3 months of blood glucose self-monitoring records. That's not optional. If you don't meet the standard DOT vision requirements, for example, if you have monocular vision, you may need the Vision Evaluation Report, Form MCSA 5871, signed by an ophthalmologist or optometrist. The examiner has to receive that form and begin your exam within 45 days of the eye doctor's signature. If you operate with a medical waiver, exemption, or a skill performance evaluation certificate, bring those documents. They go directly on your medical examiner's certificate. If you've been diagnosed with sleep apnea and you're being treated, bring whatever documentation your provider has given you about your current treatment and how it's going. And if you've had a hospitalization, surgery, a new diagnosis, or you're actively seeing a specialist, bring the most relevant records you have. A discharge summary, recent test results, or a provider note can be the difference between a same-day decision and a return visit. The goal is simple. Give the examiner everything needed to make a clear decision while you're still in the building.